The dreaded dark under eye circle. Are we stuck with them forever? Today, I'm going to give you a really easy way to analyze your dark circles and tell you what you can do about them. Dark circles are a common problem, whatever stage you are in life. I see everyone from 20-somethings to postmenopausal women in the clinic, and they complain all the time about this pesky beauty problem. I think to get to the root cause of dark circles, you need to understand why we're predisposed to them in the first place. And that means looking at a bit of anatomy. Now, let's think about the eye. So we have a jelly ball essentially sitting in a bony orbit, and it's strapped in by soft tissues. We've got fat, we've got muscle, and we've got skin. Now today I want to deal with the issues that we can tackle through our skincare routine. This is not a video about tear trough filler or surgery. We are just talking about what we can easily influence with our daily skincare routine. Now, lots of lifestyle factors can influence the state of your dark circles, like how much sleep you've had. But at the end of the day, dark circles come down to one of two problems. Is it a blood vessel problem or is it a melanin problem? Now, what I would caveat that with is that whatever the problem, it's going to look worse as we get older because of our skin's tendency to thin. Thin skin is a big problem when it comes to our eyes. That's because we are naturally predisposed to have thin skin there anyway. It is the thinnest skin on our body, and it gets as thin as 1 millimeter on the inner corner of the eye. The way to differentiate between pigment and blood vessels is through the pinch test. You simply grab the under eye skin for a couple of seconds, and then you look at it and see whether or not the dark circle has disappeared. If it disappears, it's a blood vessel problem, and if it hasn't, it's a melanin problem. So first, let's focus on a melanin problem. For those with melanated skin, a dark circle is pretty much normal. And you'll notice that pigment is visible not just on the lower lid in the dark circle, but also on the upper lid. This is the kind of dark circle that I advise my patients to learn to live with. This is part of you, it is part of your natural beauty, and it is something to be accepted, not something to be struggled with, because when something is built in and genetic, it really is just not worth our effort. However, pigmentation can come about because of extrinsic factors. So for example, if you struggle with eczema around your eyes, the consequence of ongoing inflammation and oftentimes rubbing will drive the hyperpigmentation pathway. The first thing to do is to get control of the primary problem. So to control the eczema, to stop further inflammation and pigmentation. And then once the skin is under control, we can tackle it with ingredients that help reduce the amount of melanin in the skin. We always have to be cognizant of the fact that the under eye skin is extra sensitive. So that means seeking out ingredients like niacinamide, which is brilliant for pigmentation around the eyes because not only does it help reduce melanin, but it also helps bolster our skin barrier through increased ceramide production. Other ingredients that can work well with niacinamide include those that inhibit tyrosinase, and I'm a huge fan of something called milk thistle extract, which will help reduce the activity of tyrosinase and also reduce the amount that our skin produces. Finally, retinoids can be super helpful if you can tolerate them, and if not, then I think bakuchiol is a great plant alternative to using a retinoid that's also well tolerated around the eyes. We of course want to use sunscreen around our eyes on a daily basis, and I think this is such an important habit to reinforce to yourselves because many of us tend to miss the skin around the eyes. Oftentimes the reason for this is that sunscreen that runs into our eyes can cause stinging, and this is a particularly common problem with chemical sunscreen. So if this is you, try mineral sunscreen, you'll find it's much easier to tolerate. Then we come on to blood vessel problems. Now, blood vessel problems can happen at any age, but they definitely appear worse as we get older. And that's simply because the skin gets thinner. Now, we lose skin thickness as we age because we lose around 1% of our collagen every year from our 20s. But when we hit menopause, that rapidly accelerates and you lose as much as 30% or a third of your skin thickness in about 5 years. And that's why keeping our skin thick and resilient is so important if we have a blood vessel problem. We all know the ingredients that are involved with keeping collagen thick and perky. We want, of course, to be using a retinoid, but in addition, niacinamide is also effective here, so another multitasking ingredient, as is bakuchiol. When it comes to improving the quality of the blood vessels themselves, we can actually use ingredients now to strengthen and make them less leaky and improve capillary flow. And one of the ingredients I like best for this is something called alpha glucosylhesperidin. To make matters worse, when you're tired, your blood vessel problem will get worse. And that's because our capillaries tend to open up and dilate. Now think about our whites of our eyes when we're tired, they become quite bloodshot often in appearance. The same thing is happening in the blood vessels in your skin. Now caffeine will have a tightening effect because it tends to constrict down blood vessels. So you can either reach for a cream enriched with caffeine or make a pot of tea and do your own. Remember, this is a temporary fix, but once you get your sleep pattern back on track, things should settle. And the other ingredient I look for that can improve the quality of the circulation and the blood vessel situation around the eyes is vitamin K. So I've given you a really easy framework to analyze your dark circles with, and some effective solutions that tend to work in other areas of the eye area as well. So you're going to get more bang for your buck. So I think the route to happiness with dark circles is to have realistic expectations and a great quality concealer for those days whenever you want a little extra.